when I was informed that I was selected to be university professor, I was very, very honored and thrilled, actually, because in many ways, I feel it's a recognition and maybe an appreciation of a lot of the work that not just that I do, but actually that my whole team does. Not just the current team that I work with, but all the people I've worked with for so many years. I chose infectious disease because I was interested in public health and because it was also recognizing that certainly in a country like Egypt and poor countries around the world, infectious diseases dominate the public health arena and are clearly the biggest killers and the biggest health challenges. It was a field where many of us in infectious disease believe we can have almost an immediate impact, that we can treat people who are sick with an infection and get them well rapidly and quickly and effectively. And HIV, of course, changed that completely, because here we came with this idea and this thinking, and then we're confronted with a disease that was chronic. People who are infected with HIV are chronically infected with HIV. We don't have a cure. And also it was deadly. And certainly in those early years, being diagnosed with HIV was essentially a death sentence. There was something about the combination, the confluence of the effects of this disease itself as a medical condition and the suffering and pain and disfigurement, at the same time the effect it had on people as people and how they felt they belonged to their communities and their families, and then and also the response of the society to HIV. The confluence, I think these factors was so profound, and I think there was something about this confluence of characteristics that I felt just compelled me to engage in this, in trying to deal with this epidemic in any way I could. Clearly with the discovery of treatment that works, I mean, it was almost a historic discovery of the treatment for HIV, what we call antiretroviral therapy, which happened in 1995. And almost overnight, this deadly disease was transformed from a death sentence into a chronic illness. People who had HIV, who were literally bedbound at death's door, were able to get up and feel better and go back to work and have productive lives. And that was a very powerful transformation that changed really how we thought about HIV. But that was really happening largely in developed countries, in wealthy countries. And there were lots of issues even in the United States about providing access to, again, the same disadvantaged populations. And my work then was largely at Harlem Hospital, where we were also trying to push the envelope and to say everyone who has HIV should have access to these treatments. And we have to enable the environment, to enable the health system, to enable our systems to be able to do that, in a way that addresses the needs of not just the individual with HIV, but addresses the needs of their family and so on. I think HIV has changed me in a very fundamental way, and I think it's changed a lot of people in very fundamental ways. I think in many ways I was a naive young doctor who feels all-powerful when this started, that you learn, you're good at what you do, and you feel that the knowledge you have and the skills you have are sufficient, that you're just going to be able to tackle whatever you face, and you continue to learn and so on, but that somehow you yourself as an individual have to maintain the skills and build the skills, but you can do everything that's needed. And I think HIV really just took that whole notion and threw it up in the air. And I think initially it was realizing the importance of a team, and I use the word team in the broadest sense. The importance of that, by me diagnosing something and giving someone a prescription is just one little piece of what this individual and this family needs, and they need so many more things. And that one little piece I do is maybe quite useless if they didn't get all the other things they need. And that's kind of evolved the concept we've built over the years of the mosaic, the pieces of the mosaic that are really critical in order to have a picture in the end. And an individual may need supportive services to be able to get the medicine. They may need housing, they may need nutrition, they may need, women may need reproductive health care. Children need a lot of developmental training and nurturing and so on. The importance of nursing as a profession, as part of the healthcare workforce, the importance of the outreach worker, just the idea that what happens outside a clinic and outside a hospital is just as important as what happens in that exam room, was a revelation to me.